Irada Hospital, and I am passing her the stage to deliver the speech. I'm just going to pass her on here. So if I click on, okay. Morning, Roua. Are you able to share your presentation?
Yes, good morning. Excuse me, I can hear you.
Morning, can you hear me?
Good morning. Now I can.
Hi.
You hear me?
Yeah, I can.
Because it is shut down of the technical issue, then it's close it.
Yeah, Zoom. I think it does that sometimes.
Yes. I'm sorry, this is my time now to
Yes,
be sharing the content.
Yeah, it's I've just said that you're doing your presentation. So the floor is yours.
Okay, thank you.
Thank you very much.
Assalamu alaikum. Good morning for all and good afternoon for some. My name is Roua Aman from Saudi Arabia. I'm bachelor degree nurses, master degree of healthcare management. We are a group of researcher association in Eastern province. We do this study about assess the causes of absenteeism and the factor affecting it among nurses working in Eastern regions in Saudi Arabia. I will be talking about the introduction, significance of this study, statement of the purpose, specific objective, research question, and research methodology, setting, tool, conclusion, and the reference. You know, the largest group of healthcare provider in the country are nurses. They deliver the high percentage of healthcare, despite the fact that being the largest group of health provider, the nursing workforce has experienced an acute shortage affecting the delivery of healthcare. Saudi Arabia is challenged also with a chronic shortage of qualified Saudi nurses, accompanied by a high rate of absenteeism due to uncertain causes. Significant of this study, the research aimed to assess the causes of absenteeism among nurses working in general hospital and to compare with other nurses working in psychiatric hospital in the Eastern region in Saudi Arabia. Our research question was, what are the causes of absenteeism among nurses working in the hospital? The literature review was the line with the strategies of a transformation in health sector and the mission to improve working environment, which has significant impact on improving the challenge. Faced the nurse, when which is the low ratio of nurses in practical to the increases population level. This Ministry of Health, the healthcare service are complex, required higher degree of knowledge and well coordination situation to deliver a well organized and effective healthcare system guideline. Staff nurse shortage has been a significant problem in the workplace. Absenteeism can be considered as an important indication regarding the performance of health workers, as well as a good measurement of the psychological and physiological health of health workers. To clarify the meaning of absenteeism, it doesn't only mean as a non-work attendance as a schedule, but also include an unscheduled shift part-time absence. Moreover, it doesn't expand as arrive late, leave early, and take long off day, more than duty schedule in their work. However, absenteeism is usually measured by the frequent or duration of working days lost. Unfortunately, absenteeism is a dilemma that nurse manager has to deal with everyday routine. In general, nurse frequent absenteeism take into consideration as a negative expression and insufficient productivity. As a result, absenteeism has significant effect not only in the quality of patient care, but also impact nurses' value and behaviors. According to a study, the absenteeism has effect in the psychological and professional well-being of nurses. In addition, it could increase the psychological stress in the nurses remaining in the duty and increase the workload wherever given extra tasks to finish. It may also increase the risk of medication error and leads to unhealthy working environment. Nurses working in good environment area with safety, less mental and physical stress and working better than other area with less absenteeism. According to the statistics of the Prince Saud bin Jaloui Hospital and Al Ahsa Hospital, in year 2018, it was found that absence rate up to 79% among nurses. Although there are quite many studies about nurses in Saudi Arabia, they are not attention about the absenteeism causes and the factor affecting it among nurses in hospital in Eastern region in Saudi Arabia. For this reason, the current study will be carried out in General Hospital in Irada Complex for Mental Health Eastern region, this hospital in Dammam, and the investigation causes absenteeism among nurses absenteeism and take in consideration many key factors, example, culture different, work environment, year of experience, and job specification. And this is a study done by in the Al Ahsa and Dammam and Khatif and Dammam. It will be mental health and general health hospitals in Eastern, all in Eastern province. Method procedure, research design, a descriptive exploratory quantitative study design will be used in this study. This study will be carried out the male and female psychiatric unit and rehabilitation in Irada complex for mental health, Dammam in Saudi Arabia. Each has capacity have 70 beds, the total number of nurses 429 in the complex. And also the emergency room and female patient medical surgical wards in Prince Saud Jaloui Hospital and Al Ahsa. Hospital capacity 250 and to 220 beds. Each unit has capacity of 30 beds. The total number of nurses 376. Between the males are 35 and the number of female nurses 173 in both sections. The number of Arabic speaker nurses around 57 of the total number. Also in the Khatif Central Hospital at the emergency room, female and male, inpatient surgical and medical wards, hospital capacity general 329 beds, total number of nurses equal 453. Moreover, the Dammam Medical Tower Hospital also capacity general 423 beds. Total number of nurses equal 1,287 nurses. Subject convenient sample was used. All nurse staff were available in the mentioned set during the period data collected, who were willing to practice in research include. Participate in the research was included. The researcher matched between setting as much possible. Was used to this study, the practice and environment skill, structure interview, socio-demographic data, including gender, age, material status, distance from work, and year of experience. The method was ethical approval was obtained from ethical committee from the Ministry of Health. Official written permission to conduct the study was obtained from the responsible authorized. Participants were informed about the aim of this study to ensure about confidence and privacy of the content and the result. The researcher handled the questionnaire to the staff online form. The researcher were considered time planning in order to permit at least 30 minutes for the question to be completed. Statistical analysis to collect the data was analyzed and tabulated using SPSS for Windows. A proprietary statistical test was used. Statistical significance was considered at p-value less than equal 0.05. The result of 350 participants, 257 completed the question. Constating response rate of 73%. The majority participants were women, Saudi Emirate standard deviation equal 1.033. Regarding their education, most participated had a diploma degree with equal 1.17. Regarding for work experience between less than 1 year and more than 20 years and mean standards deviation work experience of the participant was 2.442. It will be shown in the table. And on another hand, 104 nurses work more than 5 kilometers, 20 kilometers, whereas the mean was 2.27. There was a statistically significant equal 0.001 between the participant and the number of days of absence in the last 3 months. There was significant population equal 0.992 merit and absenteeism. In addition, nationality nurses was no statistically significant in the overall study, be equal 0.532. One way ANOVA was conducted determined the difference between the participants in different departments. Pediatric intensive care unit showed the highest score for absenteeism, mean equal 2.60, SD equal 1.035, while outpatient showed the lowest score, mean equal 2.56, SD equal 1.014. There was significant difference in absenteeism between Prince Saud bin Jloui, mean equal 2.94, SD equal 0.885, and Qatif Central Hospital, the mean was 2.34, equal 1.073. A total of 257 participants joined this study. Present the demographic responded where majority of respond 79% female and 20% male. 82% Saudi, 70% none. Of representatives, 24.7 married and 21 single. Divorce 3.5, we do 8%. Most of the responded 61.9 diploma, 34 bachelor degree, and 1.9 percentage master and PhD. 40% 0.55 than 5 kilometer to 20 kilometer, and 70% less than 5 kilometer, 23% more than 20 kilometer to 50 kilometer, and 7% more than 150 to 100 kilometer. 15% more than 100 kilometer to 100 kilometer, and 14% more than 200 kilometer. Majority of responded 32.7 of Katif Central Hospital, 31.5 Prince Saud Njaloui Hospital, and 18.7 Irada Complex for mental health, and 17.1 in Dammam Medical Hospital. Limitation study. This study had limitation related to the number of participants, 257, and this finding are relevant to sample only. Sorry. In this study, duration of work experience, 8.9 percentage less than 1 year, 26.5 percentage of respond, 1 to 5 years, 29 percentage experience, and to 6 to 10 years, and to less than 20. Analysis showed absent in the past 3 months, and what the causes among the response of absenteeism are: majority is having health problem, personal and family problem, 60 percentage non-cooperative from supervisor working in different without weekend off. In addition, no supportive and appreciated from head of the different factor influencing absenteeism among nursing staff in the hospital. Majority of them is presents health problem. In addition, there is represent where extremely dissatisfied in the general relationship in the unit, resolving disagreement, conflict, and work motivation, stress develop way involve nurses awareness and involvement of the staff toward achieving the specific goal in the unit. Work in the administrative time. This majority of the respondents answered they have never been absent for months, thus considering their level specification and commitment skill. Development motivation strategy. Employees feel that their work is value and creating flexibility by providing a flex time, because nowadays employee value personal time, especially for family needs. Motivation, initiate the staff will involve them in all strategic plan and goal of the hospital, administrative hospital. The recommendation proper communication in the form of regular meeting between qualified staff members, lecture, education program, aware of the problem experienced by the head qualified to improve the relationship. All administrative to be good relationship with the staff and cooperative with them situation. Oh, thank you. Just before that, challenge are what make life interesting, and overcoming them is what make life meaningful. Thank you for all for your listening.
Oh, thank you very much for sharing that. Has anyone got any questions? I just wanted to say that I think it was a good presentation, and I think it's very important to highlight the impact that mental health and other factors that affect the nurses and how it can cause high levels of absence and whatnot. And I think it's good they did a systematic review around that and got the different factors that were involved, which I thought was quite interesting.
Yes. Yeah. Thank you for you also and for your listening, and must be motivation our nurses and good relationship from the administrative and the head department supervisor with our nurses and everywhere. This is the time for them to be also care of them to be giving more, because all hospital, I think, need the nurses to be in good, healthy, and good mentality and more motivation to good care for others.
Definitely, definitely. And they're all doing a great job.
Thank you. Thank you.
Anyone got any questions? If anyone does have any questions, just put them in the box and hopefully we can answer them later. So, I guess it's time for